All right, welcome to Bayou Time. I'm Martin Falls, and what a great topic we have today. And the topic is, how important are our local pharmacies in the area? Have you ever stopped and really thought about that? Well, the panel is going to try to educate you on that today, because you've seen the changes. You've seen the big box pharmacies come in town, but we still have the ones we grew up with, the local faces. Some are here today. Let's meet our panel. First of all, we have the Louisiana Independent Pharmacies Association President, Mr. Randall Johnson. He's closest to me. Welcome aboard. How are you today?
I'm well, thanks very much, Martin.
All right, we have Ms. Nikki Ollier. She's a pharmacist and an independent pharmacist, and we appreciate her being on with us today.
Thank you.
We have a very familiar face, Robert Rock, here in the area, and he's with Haydell's Pharmacy. And we have on the far end Mr. Ming Nguyen, a pharmacist here in the area. So appreciate all of you being here. Thank you all for coming.
Thank you for having us.
All right, I guess just for sake of being transparent, this is a tough subject. It's going to take a lot of explanation, because wherever you go to have your prescription filled, you normally go to the window or you go to the counter, you get it filled. A lot of you don't know how it got filled, who's getting paid, why it costs a certain amount of monies. You take it, you go, oh, it went up. You pay it, you move on, you go bring your kids to soccer, you live another day. It is deeper than you would imagine. So we're going to start off with Randall. We're going to let him explain why we're sitting here on a Bayou Time set talking about this, and we're going to have an extended conversation today on why you're paying a certain amount at the pharmacy. So, Randall, I'm going to give you the floor.
Thanks very much, Martin. And I'll tell you, I appreciate you starting off that comment by, let's be transparent, because that's really what our pharmacies want the patient to understand that they need to demand. They need to demand transparency in what drugs cost. They need to demand transparency in how much that pharmacy is getting paid for that drug and how much they're being billed by that insurance company or that PBM for that. And when we look at these opportunities, then we believe that we can help the patient have access to necessary prescription drugs from a lower cost situation that will help reduce the cost of health care, not just for them, but for the companies they work for the payers of the bills that may be out there. You know, we talk about our significant problem is looking for that transparency with pharmacy benefit managers. Pharmacy benefit managers started about 30, 40 years ago as claims processors. And they came in to help be able to process the claims. When you and I were growing up, then what you started with was your parents went to the pharmacy, you went to the doctor, you took your prescription in there, and then you walked out of the pharmacy with your prescription and you had a couple of different receipts on there. You took one to Human Resources. Your dad may take one to Human Resources to the department, because that was in an age where we really had maybe one breadwinner in the family. They would get turned in, you'd get paid for that prescription, you'd go back and you'd pay your pharmacy, because they tend to keep a house account. That's not really any different today, except now the PBMs are involved in that, telling the pharmacy what drug to use, telling the patient what drug they're going to take, and then telling the doctors what drug to prescribe based on being able to hide the cost of those drugs and being able to look at something called rebates and how much money they're getting back in order to allow you to take a drug, in order to allow your doctor to prescribe a particular drug to you. In any other business, then it would be, a rebate would be a kickback. A rebate is where a drug costs more to the pharmacist. The pharmacists are the first people who suffer having to deal with the increased cost of prescription drugs, because they have to buy it from the wholesaler and the manufacturer in order to put it on their shelf, in order for you to be able to have access to that prescription. But that drug is costing more, and it's costing more because of the rebate program. If we look at our state Medicaid program, it insures 2 million people in our state. The program in total costs the state right at $2 billion a year, of which they get about $1 billion in rebates. So imagine
So the
that
state of Louisiana is getting $1 billion in rebates.
for the Medicaid program.
What's the incentive for them to work with small pharmacies if they're getting $1 billion from the system?
They're getting that from the PBMs, and they're looking at this, really this misinformation, the need for transparency, that if we could reduce the cost of prescription drugs and pull those rebates out, then allowing the physician and the other prescribers that you may have to decide what medication is best for that patient without it being driven by how much they can get in a kickback, how much they can get in a rebate. Now, our group benefits program, our Office of Group Benefits is the program for state employees, a number of other local government employees, like some school boards and some local governments, the dependents of those, and about 40,000 retirees of those programs. So it's about 240,000 people that are served through that program. And that's really what has driven our concerns to be able to bring this issue forward for you to be able to talk about it with your listening audience.
Mm-hmm. Nikki, let me come to you. Let me ask you this, because obviously you get people in there. Just tell me if I'm right or wrong. If somebody goes in your pharmacy, I think most people think if they go to a chain pharmacy, the so-called big guys on the block, okay, that they're going to save a lot of money at Walgreens, CVS, those places compared to your local pharmacy. That's a myth, isn't it?
That is a myth. That is a myth.
Explain to the public why that is.
Well, first of all, we don't have as much of the overhead, and because we are forced to run our business on a day-to-day basis, there's nobody in a home office doing that for us. We're doing it every day. We run a really tight ship. We also tend to be the people on the front lines and at the counter, across the counter, talking to those patients. So not only are you going to get a competitive price, you're going to get more personal care, and you're going to get better care in most cases. And I'm not taking anything away from our chain pharmacy brethren, because they're good people, they're good pharmacists. Their working conditions are stacked against them. They have people in corporate offices out of state who simply look at numbers. They don't look at people, they look at numbers. We look at people. When you're across the counter from us at our store, you're not a transaction, you're a patient. You're a friend, you're a neighbor, you're a family member. We treat you like family. We even have it in the name of our store, Olier's Family Pharmacy. And that's what's been so difficult about this OGB situation is because with this contracting dispute that we find ourselves in with Jay Darden and the Department of Administration for the state, Office of Group Benefits, this contract that we've been offered puts us underwater to fill those prescriptions for these OGB patients.
And before I get to Robert and also me, talk about that in detail, because I want the public to understand how can local pharmacies be fighting the state? If we lose a local pharmacy, we sort of lose the bloodline of the local community, because doctors go to the local pharmacies, and you're sort of cutting out
That's correct.
the meat and potatoes of the whole thing.
Yeah.
Talk about this.
If you think back to all of the old TV shows, a local pharmacy always played very prominently in the storyline. It was always there on Main Street in any of those street pans of those old shows. And there's a reason for that, because a lot of times that local pharmacy is the heart and soul of that community. And that's still true today. Our legislators are unanimously in support of our local pharmacies across this state. And they're also unanimously in support of the OGB patients that are negatively impacted by this contract.
There's so much money being paid to the state. They're looking at the big picture, which is money to the state compared to the processor.
They're failing to, but they're failing to see the actual big picture. Because the reality is, if the 450 independent pharmacies in this state are forced out of business by being forced into these terrible contracts that negatively impact our bottom line and get forced out of business, what does that mean for the big picture for those patients in that community and for that community as a whole? Imagine that there's no independent pharmacy in this state. It's a terrible thought. It's a frightening thought. And imagine if the patients who live in our more rural communities in this state don't have a pharmacy within 30 or 40 miles, because guess what? There's no CVS, there's no Walgreens.
That was my next question. They pick population areas to
Correct.
build.
Right.
Correct.
So if y'all get
Put out of
bogged
business.
down so bad that you can't survive, they're going to be making long trips into town.
Correct.
That's correct.
And they're going to go without their medication, which eventually is going to lead to hospitalization, more injury, more illness, possibly death.
Let me ask you this, Rob, before I let you elaborate on that. You were right down the street
Right,
at Mr. Ronnie's drugstore and Haydell's drugstore,
Right.
which of course you're a part of now. Used to walk in there, it was a town meeting.
right.
They were drinking coffee. Sometimes it was like tar. It was so thick.
Oh, yeah.
But Mr. Ronnie Haydell, I remember, you didn't have to pay right there. And the drugs that you needed were readily available. And if they weren't, they were in fairly quickly.
exactly.
I also used to bring Kodak film from my movie camera in there, and he would ship it off to Kodak, and I'd pick it up on Tuesday.
Right.
It was much more than a pharmacy. I was looking it up this week, and I saw that because small pharmacies, people don't buy a whole lot of other things when they go in now, that really only 3% of the population buy other items that are in the store. So if they don't go in there and buy a lot of whatever else y'all have on the shelf,
Right.
you're not going to be able to make up that profit and loss difference.
Exactly.
How hard is it for you right now?
Well, it's tough. And administration's logic was, if we can't sell brand prescription items because we lose so much, I mean, I'm talking a box of insulin and losing $70 plus on one box of insulin. They said, well, you can make it up in generic sales. That's like, no, you can't. You have to sell more of generics, which are much less cheaper. And by no means are we greedy. We just want to be treated fair. And to expound upon what Nikki said about having to drive 30 to 40 miles, the big box chains have created across the United States, and it's a well-known term, they're creating pharmacy deserts, which means there's no local independent or accessibility to local health care, which in turn dumps into the emergency room system, which we all know how expensive an emergency room visit is. So it's like trying to get state and local government to understand the rebate is not the magic bullet. It's not the silver pill. We're on this healthcare bubble that needs to be addressed, or it's going to pop.
And before I move to Maine, I know this might not be a good comparison, but if you look at the Walmarts or the Sam's, like Rouse's, you know how they combated it? They went open 64 stores.
Right.
And they had buying power at that point, so they were able to match the stores. But I've been thinking about all the mom and pop, for lack of a better word, stores along the way that have fallen by the wayside. And it's not only you lose, and I'm gonna come to Meg here, not only you lose your ability to take care of the rural area, you sort of lose a piece of the community. And
Exactly.
and I agree with all, I think Nikki said it, You got some wonderful pharmacists and people that work in the chain store. It's not their fault. It's not their fault. It's the process of where it came to. And what really gets to me is that in any other medical practice, if somebody's getting money on the side, that's serious. They could go to jail, they could be charged, but y'all told me there was a safe harbor. Was it a law actually passed, a safe harbor, or was it indoctrinated in it that I think came through the Trump administration?
Safe harbor is something that is decades old, and I believe that its original intent was to be able to allow low-cost prescription drugs. But it's been manipulated by the PBMs to the degree that it's added cost to prescription drugs. You know, and you spoke about the rural pharmacies, but understanding our small business independents are located in our neighborhoods of our largest cities in the state and nation, as well as our smallest communities. And it's that service that allows them to be there. It's the service delivery that they have. When you're a few minutes late and that store's about to close, then you may be able to call that pharmacy and they'll stay open for you. That pharmacy, our independent pharmacies, are delivering to the patient's door. So when that patient is unwell, unable to travel, unable to get there, then that pharmacy is delivering to that patient. Mm-hmm. We run into a situation that if you're not in that rural community, look at the cost that a patient may have. You take a state employee that worked for 40 years and started to work at 20 or 21. They've got full retirement and they retire at say 60, 61, 62, but they're living to 85. And when you're 85 and you bought the car when you retired at 60, and your car is 20 years old and you're having to go and really threaten your health care that you have, can you, because you're 85, is it easier for you to drive the 30 or 40 miles that it may take to get you to a pharmacy and network, as opposed to that pharmacy provider that you trust as that health care provider that's been taking care of you and your family for generations?
But Randall,
Nikki?
sometimes it's not even about safely driving 30 or 40 miles. They're saying network adequacy is within 10 miles in some cases. Well, if you take the Breaux Bridge area, for example, we are 6 miles outside of Lafayette, technically, from the edge of the city line. So if you take an older patient who's, let's say, 70 years old, who has been retired for 5 to 7 years, really doesn't drive that much anymore and really only drives around town, is it really safe for them to drive into Lafayette to a chain store? And you guys might have a similar situation here in the Houma area, where those folks who live in these smaller communities, yes, there might be a store that's quote unquote 6 miles away, but where are they traversing that 6 miles, and is it truly safe for them to be on the road doing that? And if it isn't truly safe, do they have a family member that lives close enough whose schedule allows them to go and get that medicine and get it to them, when they have a local pharmacy that's located less than a mile from their home, that they can safely drive to because it's a road that they're familiar with?
And I want to hear from Robert again, but Ming, let me just get you involved in the conversation. You're around my age, looking at the time you started, the amount of time you put in to becoming a pharmacist and developing a relationship with everybody that comes through your store. How disheartening is it for you to then compare it to now?
With this new contract, it's really tough. I mean, these people are friends, family. You have to explain to them you no longer can take this contract because they're not paying us enough. And it's like, they've been dealing with us for over a decade, and now you have to say goodbye. And they came to us originally because of our service and our friendliness. And you talked about safe harbor. This is what's killing us. PBMs, I think y'all touched on PBMs, what PBMs are, they process the claims for the employer groups and all. They are protected by the Safe Harbor Act, which in order for drug companies to be listed on the formulary list, they need to pay a higher rebate to the PBM, or in order to reimburse higher rebates to the PBM, they have to charge more for their drugs. And in any other business, that would be against the law, but Safe Harbor protects these PBMs from doing that.
But didn't President Trump and others make it possible for y'all to disclose certain costs where before it was illegal? Explain it, because that's something I think the public really needs to hear. And has that changed under the Biden administration?
Yeah, the gag clause allows the pharmacist to tell the customer or the patient that if your copay is high and the medication, if you pay outright cash for it, is cheaper, you have the ability to tell the customers that. And that's the anti-gag clause, is it? Yeah.
Yes.
And that was allowed by President Trump. He signed that law to where we can. Prior to that, the contract with the PBMs prohibit or forbid us to disclose that information.
Selecting an insurance provider for your business is a big decision.
With over 26 years of experience, our offer team is your solution for quality and proven coverage.
The customer service you remember from years ago is what we pride our team on.
We know how important your company is to the community.
From small businesses to large businesses, Alford & Associates can manage your insurance. It's our job.
Alford & Associates, benefiting your employees and protecting your business.
Exciting news from Barker Honda. Introducing the all-new 2023 Honda CR-V. A new rugged design, longer, wider, with a significantly broader stance. Spacious interior with more premium high-tech features. More second-row legroom comfort. Plus, larger rear cargo space with power tailgate. Hurry in and see the all-new, larger 2023 CR-V now in stock at Barker Honda, your local President's Elite Award-winning dealer.
Structural heart disease refers to a defect in the heart's valves, walls, or chambers that keeps the heart from pumping blood properly. Valve or structural heart problems may be present at birth or develop over time. Your risk increases if you have high blood pressure, plaque buildup, history of heart attack, take certain medications, or have certain heart infections. The Structural Heart Program at CIS and Terrebonne General provides innovative solutions and devices with the latest technology to bring the best possible outcomes for patients. Learn more at cardio.com.
Here at Rouse's, we have our own brands of products, which you'll find down every aisle of our stores. These are the best quality at the best price. They compare to the national brands we sell, but at a lower cost. Most are made right here, but we travel the world too. And we personally taste test and guarantee every item. So if our name's on the label, you can trust it's good. Rouse's brand, best quality at the best price.
Terrebonne General Health System, where medical science meets the art of caring, is committed to providing the latest advances in medical technology with a gentle, caring touch. This is evident in our high-tech, high-touch approach to healthcare. As a trusted healthcare resource, we deliver both life-saving, compassionate inpatient services and life-changing preventive care, while also providing wellness needs and outreach throughout the Bayou region. To learn about how Terrebonne General is providing innovative healthcare solutions, visit tghealthsystem.com.
Insurance companies often deny, delay, don't pay enough. Hurricane Ida has decimated Terrebonne and Lafourche parishes. By now, you've heard that thousands of people have been taken advantage of by their insurance companies. Don't give up. At Waits & Downer Law Firm, we want to make sure that you have all the facts when dealing with your insurance company. We have the legal experience and ability to make them pay. Get the help you need. At Waits & Downer, it's our goal to not only get you a full damage recovery, but to get the insurance company to reimburse your legal fees. So once again, don't give up. That's exactly what the insurance companies want you to do. Call today for a free consultation. We are local and we are here to stay. Let our years of experience work for you. Pick up the phone, 985-876-0870 for a free consultation.
as the association president, pharmacists were threatened when they would.
They were. I mean, we had a pharmacist that owned his own pharmacy, and like many of our pharmacists, they're buying insurance for themselves, they're buying insurance for their families, they're buying and supplying insurance to their employees. And this pharmacist was at home, got his EOB, his explanation of benefits from his insurance company on what the PBM said they had paid the pharmacy for his prescription drugs. He went to his pharmacy and he compared what he had gotten paid at the pharmacy for his same prescriptions. He sent that information to his insurance company. They sent it to the PBM and said, explain this. Well, the way the PBM explained it was contacted that pharmacy and threatened to remove him from the network, refused to allow him to fill prescriptions for that PBM because he had spoken with himself. You know, he was getting in trouble for talking to himself. So we also had a pharmacy that brought this information up. The pharmacy, like in many of our community, was working with his local sheriff's office. He was familiar with those folks. They'd gone to school together. They had their families in the same community. They went to church together. And when those folks would come in and he would see that their cost of their copay was higher than his cash price, then he started telling them, I can sell this to you for cash, and you don't use your insurance. Mm-hmm. When they expressed that to their boss, he took his prescriptions in to look at it, and he asked his human resources, explain to me why it is that it's cheaper for us to pay cash than to use our insurance when we're providing that insurance benefit. So that PBM threatened him. We'll take you from the contract. Because of our legislature and what we had, they stepped forward to prohibit that threat to contract. There was a large PBM that came in and says, well, you can do something in Louisiana, but you can't do anything for some federal protection that's with ERISA and with Medicare. But Senator Bill Cassidy saw that happening. He was able to look at what our legislature was doing in Louisiana, because any of you can go online and watch our legislative hearings. Senator Cassidy and Olympia Snowe, then passed a piece of legislation in 2018 that was signed by President Trump, one of the first pieces that passed through both houses of Congress and were signed by President Trump, that allows our pharmacists in the nation to share the lowest cost alternative with their patients. And that's what our pharmacies are focused on with this group benefits population, is to show them the opportunity that, particularly with generic drugs, their lowest cost may be in a cash payment from to that pharmacy instead of using their insurance and paying an elevated copay.
The elderly, and this is where it's tough on the politicians, I want y'all to listen to. If an elderly woman goes to see Robert Rock at Haydell's Pharmacy, and she doesn't get what's happening, and she finds out that there's a difference, I don't care if it's $2 or $3. Those politicians will listen to that elderly group a whole lot. And if there's enough people questioning, but a lot of people don't know what's taking place. So the whole part of this program is to educate people that's going on. But how are you able to explain to the people coming into your pharmacy what's happening? But that takes a lot of your time and resources.
It does.
It does.
It does.
It does.
We have had to educate OGB customers on what is taking place. It has been a very fluid situation, changing by the hour. And we have upcoming update status reports this coming Friday in Baton Rouge. And a bunch of us are trying to go to exactly see where we stand, because we are starting to see cracks in OGB's plans of accessibility. And to expound on what Nikki was saying about, you have what's called maintenance medication, your regular monthly, everyday things you take to sustain your blood pressure, your diabetes, your breathing, your COPD. Those are maintenance medications. What if a patient has an acute respiratory tract infection? They need treatment right away to keep them out the hospital. That same patient has to drive the 10, 20, 30 miles and be told, wait, you're at the end of the line. We have to take care of all these other customers who were here before you. Where do you think that patient's going to wind up? In the emergency room.
Our PBMs are the largest businesses in this nation. They're among the largest businesses in this nation.
You got 450 in Louisiana, right?
We've got 450 small business independent pharmacies in Louisiana fighting, in this case, Caremark Corporation. Caremark Health is the 4th largest corporation in the world. So they're sitting there as number 4 in the Fortune 500, and they haven't gotten there from being a charitable institution.
So they have more lawyers, more lobbyists. This is once again a David versus
Truly
Goliath
David
kind of
versus
deal.
Goliath. Yes.
So
And people's lives are at stake
So
because
how,
of
I
this.
guess the process of it, you got Z fighting for you. You got Tana fighting for you. You got Dr. Bill Cassidy fighting for you. But in the long run, when the lobbyists are going around, it's a tough battle.
You need that transparency. You need a patient to be able to know what a drug cost them. You need that health plan sponsor, that employer, to understand what they're being charged for that. So we need that transparency.
So if somebody goes to Walgreens and the drug is $43, what can you sell it? What can they sell it for?
Last year, my son was feeling bad on a Saturday afternoon. It was unusual. And so I took him to the urgent care. A friend of mine's a physician. He owns an urgent care. So I took him to the urgent care. They did a swab for him. They said, oh, he's got flu A. So it's my only child. You're wondering, what can I do to help him feel better? So they sent his prescription through an e-prescription to the pharmacy across the street, which happened to be a Walgreens. So I took him back home. I dropped him off. I went over to the Walgreens because it's only about 4 blocks away. And I waited in line. I said, look, it's okay, whatever the PBM says. If it's a brand or generic, I don't want to be hung and waiting on a prior authorization, which adds to that. So I'll take whatever the prescription cost is. I have an HSA. I pay 100% up to $5,500 before my insurance program kicks in. And so the Tamiflu was $43. Paid it, went home, started. My physician called to check on my son and then asked me, did you start Tamiflu prophylactically? You should make certain you're not going to get the flu. So I said I didn't. So he called in a prescription to my pharmacist, contacted my local pharmacist, who is the folks that we would ordinarily use. And he said, yeah, I can get that to you. In fact, I've got some right now. I'll run by the store and bring it to you. So he did that. I started that. That was a Sunday in February, last February. And the next day he processed my prescription cost. It went across my credit card. It popped up in my email. And so I called him and I said, look, it was $8.56. And it's exactly the same box of a generic drug from the chain drugstore and from you as an independent. So what's the issue here? He said, well, the $43 was what the PBM told Walgreens to charge you for that prescription. The $8.56 is what your PBM was going to pay me for the prescription. And because our Louisiana legislature passed a law where you can know that lowest cost alternative, I wasn't going to charge you $43 to have the PBM then come claw back that money from me.
Where'd the other $35 go?
Well, that would go to the PBM. But because my pharmacy processed that as a cash transaction, the PBM didn't have the opportunity to claw that money back from him and didn't raise the cost to me for that same prescription drug.
So out of that $35, Nikki, where's it split? I want people to know, where's that other $35 going? Do we know?
We don't know. We don't know.
Shouldn't we?
Yes, absolutely we should. Everything should be transparent. You know, we as independent business owners are transparent. We've been transparent with JLCB. We've been transparent with Office of Group Benefits. We're transparent with our patients. When we process a prescription and we're losing money on it, we will go show the patient. We can show you in black and white. This is how much this drug costs me. This is how much I'm getting paid. This is the difference. PBMs are not transparent, and that's by design. It's a giant shell game that they play with money. And often cases, it's the patient's money that they're playing that shell game with, just like in this example that Randall just gave. That extra $35 is not technically coming out of the pharmacy's pocket. It's ultimately coming out of the patient's pocket and ending up somewhere it doesn't, I don't believe, it actually belongs with either the PBM or the insurance company. Do they deserve a fair fee for the service they provide? Sure. Do they deserve to make billions of dollars when the healthcare providers who are actually the person providing the care and the face-to-face and the patient relationship is losing money in that same transaction? No, I don't believe so.
Y'all told me billions in Louisiana. Did y'all say 2 billion?
The OGB contract is $2 billion,
70,000.
70,000.
What about the
For a
other
3-year
states?
contract.
We're talking billions and billions.
Well,
and
you
billions.
mentioned that, Martin, but I'll tell you what, there are some opportunities that some of the other states have seen to save money on this. We've seen the state of West Virginia has moved its state employees program in the same mechanism of reimbursement as our state Medicaid program. Now, our state Medicaid program is a cost reimbursement methodology. To explain what that means, our state does a survey. They have consultants that come in and they check to see how much does a pharmacy pay for drugs, how much does it cost the pharmacy all in, to have the lights on, to process with insurance, to have the brown bottle, to put the lid on it, to transmit the label, to talk to your physicians, and they've been able to determine what that value
And to
is.
make a good living. Nobody wants y'all to starve.
So-
Make a good living. That's why you did all this.
So when we look at our state Medicaid program, and I told you earlier that our state Medicaid program is a $2 billion program to provide care for 2 million citizens, that they get about $1 billion in rebates. A $2 billion program for 2 million people to get $1 billion in rebates.
Not a bad profit.
If you look at our Office of Group Benefits program, they're running an operation where it is 240,000 people that are filling about 5 million prescriptions a year, that they are wanting to spend $2,070,000 over 3 years for that. So when you start comparing the state employees group benefits program to our state Medicaid program, the Office of Group Benefits is spending well more than twice as much as our Medicaid program per member per month. That doesn't make a lot of sense. When we're all Louisiana citizens, we grow up in the same communities, we drive on the same streets, we have the same healthcare functions. We're all eating the same gumbo, we're eating the same etouffee. You know, we grow up in an area where it's like, well, if you can't cook with bacon, use butter. And those have some healthcare concerns that are similar in Louisiana, regardless of where you grew up, regardless of how much money you make.
Ming, let me ask you a question. So, I guess this is for everybody to sort of talk after Ming, and not to really get into the nuts and bolts of your business. You obviously got in business because you want to help people, but everybody, if anybody tells you they're not in business to make money, don't go there. Everybody's got to make a living. But your living has been cut and cut and cut and cut. And then you got to go out to the public and explain to them. Then you got to market against these big corporations. You got to decide whether you're going to do advertising on HTV or radio or newspaper or whatever. They got national advertising. They got pamphlets in every store you go to. They got a lot of money to go against. Are we close as a local pharmacist of, and I'm going to be drastic when I say this, of putting the key in the door and locking the door? Is it that close?
Yeah, for a lot of pharmacies, they have gone out of business. The one that are still in business had to make a lot of cuts as far as paying themselves, paying their employees, working harder to make up for the losses. It's a very tough business now as it compared to 30 years ago. And we're here to expose the problems and see if the public can help us by calling their representatives and senators and governor. And we're trying to educate at the same time what's going on. This OGB contract stands to make, well, what is it, $700 million in rebate?
And I have to say this, and I want to say it on TV. We always offer anybody we're talking about a chance to come sit in the seats and talk about their side. So if Mr. Jay Darden or anybody wants to come on, we'd be glad to have you on. We'd be glad. I'm almost thinking we need a debate, or a forum. Not so much because, you know, when we talk about things that affect the average person, this is one of them. I mean, when you hear the cooler talk, you know, people talking about the football game or this or that, sometimes it always gets to my medicines went up, or I can't get my medicines anymore, or they're telling me I can only have so much for my surgery now. It's on a train track fixing to derail. And Rock, let me ask you the same question, and I'll go down the line. I've talked to you many times. I've seen you in your days when things are rolling and everything's going good and everything's... It's tougher for you now, isn't it?
It's been a drastic change, and it's not for the better. And it's not going to be better until the public and the constituents realize they deserve and they need to contact the powers that be. If enough people complain, it will change. Like I said, we're on this health care bubble. The bubble is going to pop. And it's the sooner we address it, the better it will be. It'll be a tough pill to swallow. It's going to change the entire industry. And it has to. It happened to cable. It happened to telephone, the airlines, big tobacco. It's inevitable. It cannot sustain the corruption that's taken place, the fraud, waste, and abuse, and lack of transparency that is going on.
We were talking about that before we came on the air, and when people go to your pharmacies, they pick up their prescription, or you deliver it to them.
Right.
But it's not millions of people.
Right.
Some of these drugs being mailed out, even when the prescription is not needed anymore, y'all would tell me they continue to be mailed out.
Definitely.
Where are those drugs going, and how much waste is that? Randall?
Well, I'll tell you what, our nation is now doing 5 drug take-back programs a year. Local law enforcement's involved in it, hospitals involved in it, because you're
Attorney
trying
General was involved.
You're trying to get these drugs off the street that are just wasted. I mean, folks are sitting there getting drugs at their home that they don't want or need anymore. Their physicians don't prescribe that to them any longer. When you go to a local pharmacy and that drug's not working for you, and you're sitting there talking to your local pharmacist, and he's asking you, why don't you need this refilled? And you're saying, well, if I take it, then it causes me to have this kind of adverse reaction. So that pharmacist calls your doctor and works with your doctor to get you the proper medication. The UPS guy, as good as they are, they don't know that opportunity to reach out to your doctor and focus on that. One of the problems with mail order that we saw just a year and a half ago, as we had another hurricane that hit Louisiana, in fact, hit a large part of your market area, was we started getting these calls in Baton Rouge that there was an insulin shortage. There was an insulin shortage in Houma and Lafourche and Terrebonne and Thibodaux, and we were sitting there trying to figure out, was there an insulin shortage? What we found was that the PBMs didn't let a patient go to their local pharmacy and get that insulin because they wanted them to use the PBM-owned pharmacy or to use that mail order. And they told them, wait on mail order. Well, mail order, we could remember that the mail wasn't running, the delivery services weren't running for a number of days, even weeks. But because the national PBMs were watching the national news and didn't see New Orleans flood, they didn't think there was any hurricane damage that had happened. So they were saying, you've got to wait on mail order, or you've got to go to your chain drugstores, and those folks weren't open. Now, the chain drugstore pharmacists are outstanding people, but they're working for an employer who's making their decision, as opposed to an independent pharmacy where that small business pharmacist is making the decisions, and he's the most accessible healthcare provider. Just walk right up and talk to him, no appointment necessary.
Here at Rouse's, we have our own brands of products, which you'll find down every aisle of our stores. These are the best quality at the best price. They compare to the national brands we sell, but at a lower cost. Most are made right here, but we travel the world too. And we personally taste test and guarantee every item. So if our name's on the label, you can trust it's good. Rouse's brand, best quality at the best price.
Exciting news from Barker Honda. Introducing the all-new 2023 Honda CR-V. A new rugged design, longer, wider, with a significantly broader stance. Spacious interior with more premium high-tech features. More second-row legroom comfort. Plus, larger rear cargo space with power tailgate. Hurry in and see the all-new, larger 2023 CR-V now in stock at Barker Honda, your local President's Elite Award-winning dealer.
Insurance companies often deny, delay, don't pay enough. Hurricane Ida has decimated Terrebonne and Lafourche parishes. By now, you've heard that thousands of people have been taken advantage of by their insurance companies. Don't give up. At Waits & Downer Law Firm, we want to make sure that you have all the facts when dealing with your insurance company. We have the legal experience and ability to make them pay. Get the help you need. At Waits & Downer, it's our goal to not only get you a full damage recovery, but to get the insurance company to reimburse your legal fees. So once again, don't give up. That's exactly what the insurance companies want you to do. Call today for a free consultation. We are local and we are here to stay. Let our years of experience work for you. Pick up the phone, 985-876-0870 for a free consultation.
Structural heart disease refers to a defect in the heart's valves, walls, or chambers that keeps the heart from pumping blood properly. Valve or structural heart problems may be present at birth or develop over time. Your risk increases if you have high blood pressure, plaque buildup, history of heart attack, take certain medications, or have certain heart infections. The Structural Heart Program at CIS and Terrebonne General provides innovative solutions and devices with the latest technology to bring the best possible outcomes for patients. Learn more at cardio.com.
Terrebonne General Health System, where medical science meets the art of caring, is committed to providing the latest advances in medical technology with a gentle, caring touch. This is evident in our high-tech, high-touch approach to healthcare. As a trusted healthcare resource, we deliver both life-saving, compassionate inpatient services and life-changing preventive care, while also providing wellness needs and outreach throughout the Bayou region. To learn about how Terrebonne General is providing innovative healthcare solutions, visit tghealthsystem.com.
Selecting an insurance provider for your business is a big decision.
With over 26 years of experience, our Offer team is your solution for quality and proven coverage.
The customer service you remember from years ago is what we pride our team on.
We know how important your company is to the community.
From small businesses to large businesses, Alford & Associates can manage your insurance. It's our job.
Alford & Associates, benefiting your employees and protecting your business.
After Ida, I think Rock was open. I was open a few days after the hurricane hit. I was up and running. I got gas from LIPA. LIPA was able to contact the governor's office. We were able to get gas for our generators and keep our business going, serving the public. A lot of these doctors' offices were closed. We were letting people borrow medication, loaning them until we were up and running again, until insurance was up and running or whatever the case. Independent pharmacies were open and accessible right away.
And Nikki, just to expound on what Randall said, so they were making people go to mail orders. They were arbitrarily bypassing, well, let's say allegedly, give them the benefit of the doubt because I don't really know all the back, but they were bypassing y'all.
Yes, mail order bypasses all local pharmacies unless you're affiliated with that mail order. Because if you use a CVS Caremark mail order, they'll send it to a local CVS pharmacy for you to pick up. You don't even have to
Well,
have
how
it
do you get
delivered
involved?
to
You got to
their
pay them a
house.
fee or something? Never looked at it? That's
They-
the obvious
you know,
question to me. How do you
that's-
get,
well,
how do
you
you
know-
get to be part of the?
Well, you know, and that's part of the lack of transparency also,
Yeah.
because they offer incentives to the patient to do that. They offer them a lower copay than what they can
Do they offer y'all an
obtain.
incentive?
No.
Okay.
No.
Yeah.
But, you know, I have firsthand accounts from some of our patients who have dealt with a big box store in Lafayette because they were kind of forced to by their insurance plan. And she shared this story with me that she got a text message that her medicine would be ready on the Thursday. So she waited until Friday morning to go because that was just when it was convenient for her. So she got to the pharmacy on Friday. Now, she drove 8 miles to get there. She got there, she waited in line. They told her that it hadn't come in and that it wasn't ready and that it would be ready on Monday. So she left, she drove the 8 miles back home. Monday rolls around, she makes the trip again to the pharmacy, and it's about 1 or 2 o'clock in the afternoon on Monday, not right when they open, and it still wasn't ready, even though they had told her that it would be. They had no explanation other than, don't you see how busy we are? We're so backed up. So now it's almost a week, and she hasn't had this medicine. She still doesn't have the medicine. She had to make a third trip to the pharmacy, 8 miles from her house, and about a 25-minute one-way trip. So she's spending an hour of her time each time she goes.
Let me ask a
with
crazy question. This may be totally out of left field. But when we do a public records request in the media and we want to know information, they have 72 hours, working days, to get us that information by law. Y'all in the pharmaceutical business. Y'all have people's lives hanging. I'm sure your insurance policies, errors and omissions is out the roof. I can only imagine. But isn't there just is it an unwritten code or is it a written code that when Miss Mary comes and puts her prescription in and she needs it or she's going to die? Let me just be completely frank. And if y'all don't get it to her in a certain amount of hours, Miss Mary's going to die. Is there some kind of unwritten or written rule on any of that? Or is that just because
No.
y'all know Miss Mary and y'all trying to help Miss Mary out? Right?
When we know the patient and we know their circumstances,
Right.
you go to the front of the line because we control the line. But in a lot of big box stores, the pharmacist and their staff, they don't control the line. That line is controlled electronically by people in home office
It's a
or a
central-
district office, and everything goes into a queue in the order that it's received. So everything goes in queue. If you call in and request a refill, if you request a refill through the web page or the app, if a doctor sends in an electronic prescription for your child who is sick and screaming in the store who needs an antibiotic because they have strep, that pharmacy staff may likely not be able to move those prescriptions up in the queue to get that screaming, miserable child out of there quicker.
So I guess the
And
bottom
help that
line,
mom.
Rock, is that y'all have chosen to stay independent and local pharmacy. A lot of pharmacists have chosen to get in there. They probably got great benefits. They probably, and like I said, they're great people. They've chosen to take the route of least resistance because it's an easy fix for them. Y'all have tried to stay local, tried to help local, but it's a tough gig.
It is, and there's starting to be a backlash. These people who are in these corporations understand they have a professional license and obligation to fulfill to treat that patient's needs. And most of the day, we're doing triage for lack of a better term. The most serious, you address that. And a lot of these chain pharmacists, they're good people, good pharmacists. They are beside themselves because they are controlled, as Nikki and Randall and Ming said, by company metrics who determine you have X number of time to do X number of accomplishments. And the human factor doesn't come in. It's all about numbers and money. Box pharmacies, and Randall can address this, and Nikki too, because they're in larger communities, say Baton Rouge and Lafayette area.
Okay.
They've had instances of where patients have reported, like she said, they've gone to a drugstore, they walk all the way in the back because it's traditional, the pharmacy's in the back so that you're gonna buy all the merchandise you don't need, so to speak.
Right.
They get to the pharmacy counter, pharmacy closed due to staffing issues. No anticipated time of opening again, so they have to leave. Now, how do they know how acute that medicine is for that patient? Was it an antibiotic? Was it a blood thinner? Was it something ASAP to prevent a hospital visit? That's not taken into consideration. It's a corporate decision. We don't have enough people, close the place down.
See, you just educated me and a lot of other people with
I would sacrifice profit over customer service. I mean, I would staff efficiently in order to serve the public.
Well, we do it every day.
Yeah.
Yes.
Yeah.
I know I do at my store, and I'm sure you guys do also.
That's why you chose the profession.
If people walk in our pharmacy all the time and say, wow, there's a lot of people behind that counter. Yes, there are. That's because when you call my pharmacy, a person answers the phone, not a computer.
Right.
A
Doctors
person
love that
answers the
too.
phone during business hours. I want somebody available to help you at the counter within 20 or 30 seconds of you arriving. And if they can't get to you in that amount of time, I want somebody else available to be able to pause what they're doing to come take care of you.
Definitely.
Because your time is valuable as well. I don't want people lined up to the door. Well, I do, actually. But I don't want people lined up to the door having to stand in line for 20 minutes waiting to pick up a prescription. I want to be able to take care of that patient the way they deserve to be taken care of. I want my pharmacist, myself included, to be able to have the time to step away and counsel every patient for every new medication that they pick up, even if they've been on it before. You
Or
can't
even
imagine
answer
the
the
number
question of, can I take this drug with this drug?
Exactly. And so by chain store standards, my store is grossly overstaffed. But you know what? I take that hit off of my bottom line because that's the type of service I believe my patients deserve.
At Caremark, the company that has gotten this contract from OGB, and we look at just since last April, so in less than a year, they've been fined $237,500 by the State Board of Pharmacy purely for not staffing their pharmacies in order to provide the patient access to prescription drugs, for not having someone responsible, a pharmacy responsible for the patient access. And we're running into a situation with one thing that's happened as we look at the advent of computers and the different activities you have. So often you're getting an electronic prescription that's going from your prescriber to the pharmacy. And then when that pharmacy's not open, it's not that piece of paper that you can take to the next pharmacy. It's stuck there in that loop that you're unable to get that prescription filled until that pharmacy is open and can pull that prescription out.
How much you said they were fined?
$237,500, according to the public records from the State Board of Pharmacy.
Well, you just gave me the facts to back up y'all saying that I said that a lot of staff was wrong. That's, see, I don't think most people would have known that.
I'll tell you what, Martin, you also asked a question about a public records.
Yeah.
So we have made a number of public records requests. to the to the Division of Administration, the Office of Group Benefits. So this is an email I got 1/6/23. That's last week, 10 days ago. Mr. Johnson, in response to your September 7, 2022 public records request, please see the Dropbox link. They provided me what they have, and they tell me it's estimated more records may be available on or before February 6, 2023. So this was a public records request of September 7. Yeah. But Martin, I want you to look and see, as they give me this Dropbox link, this is the kind of information that I'm getting. And
that's pretty redacted. The whole thing's redacted.
The whole thing's redacted. And what I was asking for was, in this situation, what drugs is the state paying for? I didn't ask for patient information. I was asking
they can redact Social Security address, name.
This
the rest is fair
This was
game.
What drug are you paying for, and how much money are you paying for those drugs? Because what we wanted to do was just like that pharmacist I spoke with you about that talked to himself.
Right.
We wanted to be able to show the state.
You know, that sounds weird when you say that.
We wanted to be able to show the state that what they are paying the PBM for these prescription drugs is substantially greater than what the pharmacy is being paid for that. And we wanted to show the state the savings available to them.
I would think once this starts gaining some traction, this show, there's going to be a lot of questions that need to be answered.
I think our legislators are asking a lot of questions right now. I think it's very important that we give the recognition to our legislators for what they're asking questions on. But it is surprising that we've got the Commissioner of Administration and the Office of Group Benefits saying, we don't care what the legislature said.
That's amazing to me. I mean,
it's amazing to us too.
And you said Dr. Bill Cassidy needs a lot of credit because was he the one that went lobby Trump?
He did, and Dr. Bill Cassidy and Olympia Snowe, and in fact, the overwhelming majority of our congressmen in this nation, and considering every Louisiana congressman and both our state senators, voted for that anti-clawback piece. That piece of legislation that would allow the patient to have access to the cost information on a drug. We need our government to be asking those same questions.
Why would anyone ever not consider giving a patient the right to their own information?
Well, it's a shame, but you know, we sit here, and you and I both thought that the public records law meant you get those records in 72 hours.
Not anymore.
We're not
it's
seeing
changed.
that. Yeah, we're not seeing that.
They do what they
anymore.
want.
Yes.
Yeah. Go ahead, Rock.
You did say about how do we get involved to find out this information. Interesting enough, the Federal Trade Commission is looking at this very, very seriously. And the chairman that has been appointed is very much in tune to what's taking place. But I can't emphasize enough. People need to get involved and complain. If you don't, it's going to change, and it's going to change for the worse.
Well, if they don't, y'all won't be around.
Well, it's not so much us. Who's going to take care of them?
I agree, but y'all not being around comes first.
Well,
then they can't be taken care of the way they want.
You know,
to.
that patient.
Then it becomes a monopoly.
Yeah.
Right.
That patient care comes first.
Yeah.
I mean, that's really what it gets to, is that
Yeah.
these pharmacists are sitting there, they chose this career because they're healthcare providers, and they wanted to be able to help their patients. And they work with the doctors and prescribers that are nurse practitioners and others in order to help improve or maintain a patient's health.
Final question, and I do appreciate all of you being here. We're going to have more shows, I'm telling you right now, because this is going to...
Well, you just about have 2 right here already.
Yeah, well, probably 3 or 4. But where does Louisiana stand compared to, I know I sort of asked this question before, but to all the other states, where on the scale, where are we? Are we the worst when it comes to this? Are we the best? Are we in the middle somewhere?
Regarding regulating PBMs?
Yeah.
I would say that we're at the top of the list. We're in the top 3. in the country, I would say, in regulating PBMs. Louisiana has been truly cutting edge, and a lot of it is due to LIPA and Randall's leadership, the board of directors.
And all of y'all input.
At LIPA.
Randall, all of the pharmacists on board, I mean, y'all seem like y'all communicating pretty well. It's a family, isn't it?
Right.
It is.
Right.
It is.
Right.
It is.
Wow.
It's amazing when the national group gets together, all the other states migrate to Louisiana's delegation with Randall heading it because of the knowledge he has. I mean, they're just in awe of how forward in Louisiana, leading the nation in promoting transparency, regulation, getting to the bottom of the problem. He deserves more credit than anybody in his staff for their boots on the ground getting the job done. They give us what we need to explain to the public, you, and the legislators. A third of the legislature turns over, every 2 years, is it?
About every 4 years.
Every 4 years. And we have to educate the legislators so that they know to vote the proper way to protect their constituents.
But I'm going to be honest, there's no way to, I just did this show and you called me last week, a couple of weeks ago. This would take seminars.
Oh, definitely.
It's definitely, in education, it's costly. So I feel for y'all in the situation y'all in. But once again, I make this plea to anyone who disagrees with anything that's been said today. We have made our name on allowing the other person to walk in this studio, sit in this desk, and tell us where they think we missed, which starts debate. And through debate, sometimes you get a lot done, but at least putting it out, being transparent, letting everybody know what's going on so that you have a choice, Randall, whether you spend $43 or $8.
That's right.
He gives everybody, and I think that's all people want. They want a choice.
Right.
So I appreciate, I'll give everybody a final comment. Well, since we started with Randall, we'll start with Meng on the end. We appreciate you being here. Your final thoughts on what we've talked about today.
Well, locally, I think this OGB battle, Office of Group Benefit contract between the state and Caremark PCS Health, it's a winnable battle. We just need more people involved. I know I personally have family that has Office of Group Benefit insurance, and I have to turn him away to another pharmacy. And I think if enough people speak to their legislators and show them how we feel about having to go to another pharmacy and wait 40, 50 minutes or an hour, 2 hours, 3 days, whatever it takes to get a prescription, and they want to use the pharmacy of their choice, they need to speak up and say it. Because this contract, I believe, is rigged or manipulated by the PBMs. And they were promised a lot of money. The state was promised a lot of money, and I think they overlooked the care of the public, the public's welfare.
Insurance companies often deny, delay, don't pay enough. Hurricane Ida has decimated Terrebonne and Lafourche parishes. By now, you've heard that thousands of people have been taken advantage of by their insurance companies. Don't give up. At Waits & Downer Law Firm, we want to make sure that you have all the facts when dealing with your insurance company. We have the legal experience and ability to make them pay. Get the help you need. At Waits & Downer, it's our goal to not only get you a full damage recovery, but to get the insurance company to reimburse your legal fees. So once again, don't give up. That's exactly what the insurance companies want you to do. Call today for a free consultation. We are local and we are here to stay. Let our years of experience work for you. Pick up the phone, 985-876-0870 for a free consultation.
Terrebonne General Health System, where medical science meets the art of caring, is committed to providing the latest advances in medical technology with a gentle, caring touch. This is evident in our high-tech, high-touch approach to healthcare. As a trusted healthcare resource, we deliver both life-saving, compassionate inpatient services and life-changing preventive care, while also providing wellness needs and outreach throughout the Bayou region. To learn about how Terrebonne General is providing innovative healthcare solutions, visit tghealthsystem.com.
Selecting an insurance provider for your business is a big decision.
With over 26 years of experience, our Alford team is your solution for quality and proven coverage.
The customer service you remember from years ago is what we pride our team on.
We know how important your company is to the community.
From small businesses to large businesses, Alford & Associates can manage your insurance. It's our job.
Alford & Associates, benefiting your employees and protecting your business.
Structural heart disease refers to a defect in the heart's valves, walls, or chambers that keeps the heart from pumping blood properly. Valve or structural heart problems may be present at birth or develop over time. Your risk increases if you have high blood pressure, plaque buildup, history of heart attack, take certain medications, or have certain heart infections. The Structural Heart Program at CIS and Terrebonne General provides innovative solutions and devices with the latest technology to bring the best possible outcomes for patients. Learn more at cardio.com.
Here at Rouse's, we have our own brands of products which you'll find down every aisle of our stores. These are the best quality at the best price. They compare to the national brands we sell, but at a lower cost. Most are made right here, but we travel the world too. And we personally taste test and guarantee every item. So if our name's on the label, you can trust it's good. Rouse's brand, best quality at the best price.
Exciting news from Barker Honda. Introducing the all-new 2023 Honda CR-V. A new rugged design, longer, wider, with a significantly broader stance. Spacious interior with more premium high-tech features. More second-row legroom comfort. Plus, larger rear cargo space with power tailgate. Hurry in and see the all-new, larger 2023 CR-V now in stock at Barker Honda, your local President's Elite Award-winning dealer.
Go to Robin next, and I apologize if people hear me calling him Rock during the show, but I always call it Rock to me the first name. So he's a man with two first names, you know. So Robin,
Yeah.
Robin, your final thoughts.
Well, I think people need to realize we're focusing on OGB. That's the current situation. But it's not really the current situation. It's the norm. Whether you work for any big corporation, you are grouped in the same situation. You have a PBM, pharmacy benefit manager, that controls your prescription medication purchases. 6 companies control 90% of prescriptions sold in the United States. They tell your doctor how to treat you, what to prescribe, and how much you're going to pay, and how little they're going to pay us.
Who controls PBM?
Themselves. They, as Randall says, they are in the Fortune 500. It is amazing the amount of money they have amassed.
We also give them a chance to come on. We'll send a rep.
Hey.
I'd love to be educated on that.
To give you an example, one of our senators who is leading the fight for us, he walked the halls of state capitol begging for someone from CVS to come to the table. They were nowhere around.
Right, Ms. Ollier?
Well, thank you for having us today.
Quite
it's
welcome.
wonderful to have a platform like this that'll allow us the opportunity to educate people in this fashion, because as you stated, it's such a complex issue and it's a very complicated issue. And if you haven't been living it, sleeping it, breathing it for decades the way we have, it's so overwhelming and it's so difficult to understand because it's so complex. So I'm very appreciative to be here today and to have this opportunity to hopefully educate some more of the general population that is so impacted by this, whether they realize it or not, and to bring awareness to that. That being said, I'd also like to encourage patients out there who may be affected by this Office of Group Benefits situation. If your local pharmacy that you've been dealing with is not in the network, I encourage you to contact them, ask them to quote you some of their pricing without your insurance. Usually a 3-month supply is more cost-effective for the patient and for the pharmacy, for reasons I won't go into. I'll let them explain that on a patient-by-patient basis, but it is. And allow them the opportunity to price that out for you, because you might be very pleasantly surprised at how affordable it is for you to actually stay with that pharmacy of your choice that you already have that relationship with. I know that in our store, the people who have allowed us that opportunity, about 95 to 98% have opted to stay with us because they value that relationship as much as we do.
What percentage?
About 95 to 98%
That's pretty good.
of the folks who've been given the opportunity. Now, if someone takes a branded product, you know, it's not reasonable to expect somebody to pay that out of 100% out of their pocket.
Right.
It's not reasonable to expect that of them. But for a patient that takes all generic medications, I think most people are very pleasantly surprised by how affordable it really can be to stay with that local community pharmacy that they already have an existing relationship with.
And Randall, we'll close with you, since you know our plight here when we do public records requests. I'll give you the last word.
Well, I'll tell you what, I appreciate, Martin. I appreciate what you're doing for the community and the community that you serve. It's very similar to these pharmacies that are out there, trying to provide access to prescription drugs from the pharmacy, trying to provide access to information that's of value to your listeners is something that's important with what you do. And this is not just something that we're thinking in Louisiana. If you look at Consumer Reports, a well-respected publication, each year, Consumer Reports does an evaluation of the lowest cost prescription drugs. And what you're finding in their report is that small business independent pharmacies and Costco are your lowest price prescription drugs. Now, the difference you have there is I think we've got 3 Costcos in the state, and we've got 450 small business independents that are out there ready to serve that patient population. You're also looking, and I believe that Nikki and others have talked about, if you're taking a brand drug, remember you might be taking a brand drug because the PBM has told your doctor he needs to prescribe the brand drug where they can get that rebate, that money from the manufacturer, where they can share that. So maybe if you speak with your pharmacist, you will find that there are lower cost alternatives for you, and that pharmacist can help work with your prescriber in order to get the best medication at the best price for you.
So they're even controlling the doctors.
They're controlling the doctors by telling the doctor, this is what you're going to prescribe to our patient.
Wow.
And the reason why they're pushing brand name drug is the rebate, once again. And the drug manufacturers, it's like a pay-to-play game. The PBMs are telling the drug manufacturer, if you want to be on the formulary list, then you need to pay us more rebates. And in order to pay more rebate, you got to charge higher for the brand name. Yeah.
Woo! That's amazing.
You need a blood pressure pill now?
Yeah, do y'all have one? Yeah, what will you charge me?
I'll make you a good deal.
All
Generic
right.
price.
Thank
I'll make
y'all
you a
so
good
much.
deal.
We're going to have
Thank you.
more than this. This is an ongoing. But once again, we invite the other side. If you have something you don't agree with, come sit down, educate me some more, and we'll keep educating. That's all we can do. Thank you all again for coming.
Thank you very much.
Thank you for having
Thank
us.
you very
Thank
much.
you.
All right, there you have it. We'll take a short break. A lot more on Bayou Time. Don't go away.